Singapore is often praised for its world-class healthcare outcomes and economic prosperity. With one of the highest GDPs per capita and substantial healthcare spending, it seems logical that access to hospital care would be seamless. Yet the reality is starkly different. Emergency department wait times frequently stretch beyond 10 hours, hospitals operate at dangerously high occupancy rates, and patients are often placed on corridor beds. Healthcare workers face burnout, and new hospitals take nearly a decade to build. This contradiction between national wealth and persistent hospital bed shortages raises a critical question: why does such a wealthy nation struggle to provide enough hospital beds for its people? To understand this, we must look beyond surface-level statistics and explore the structural forces shaping Singapore's healthcare system. The heart of Singapore's hospital bed crunch is a unique financial model. Drawing on Liang Shihan's analysis, Singapore's healthcare system is designed so that annual cash inflows, through Medisave insurance premiums, taxes, and out-of-pocket payments, consistently exceed what is spent on care and infrastructure. This approach creates persistent surpluses, but it also means that investment in new beds, hospitals, and staff is chronically delayed. Building new hospitals requires large upfront spending, which reduces these surpluses. As a result, capacity expansion is always slow and cautious. This is not a result of inefficiency or oversight, but a deliberate policy choice to prioritize fiscal discipline over rapid expansion. The outcome? Hospital beds lag far behind population growth, and the system remains permanently tight. We compare Singapore to other advanced Asian economies, the contrast is striking. Hong Kong and Taiwan both maintain far higher hospital bed ratios, over double Singapore's per capita rate. Their systems are designed to build capacity ahead of demand, with faster hospital construction and lower per bed costs. In Hong Kong, public hospitals are expanded aggressively, and Taiwan's national health insurance ensures stable funding and rapid approvals for new facilities. These countries view healthcare as a public good, not just a financial asset. As a result, their emergency wait times are shorter, occupancy rates are safer, and patient experiences are generally better. Singapore, despite its wealth, lags behind because its system is structured to maximize efficiency and surpluses, not capacity. This international perspective highlights that Singapore's shortages are not inevitable, they are the result of policy choices. Behind every statistic is a human story. Long queues in emergency departments mean patients in pain, families waiting anxiously, and healthcare workers stretched to their limits. Elderly patients often deteriorate while waiting for a bed, and caregivers bear heavier burdens. The system's focus on efficiency has led to chronic undercapacity, making it fragile during crises like pandemics or flu surges. Private hospitals, while advanced, cannot absorb the overflow, especially for complex or infectious cases. Community hospitals and polyclinics help but cannot replace the need for acute beds. Ultimately, the price of underinvestment shows up in queues, delayed care, and burnout. Singapore's healthcare outcomes remain strong, but the experience of care is increasingly strained. This is not just a technical issue, it's a matter of social well-being and trust. Singapore stands at a crossroads. The current model, built on fiscal prudence and efficiency, has delivered financial sustainability but at the cost of accessibility and resilience. With an aging population and rising chronic disease, demand for hospital beds will only accelerate. The solution is clear: shift from a surplus-first to a capacity-first approach. This means building more hospitals, expanding bed capacity ahead of demand, and investing in healthcare staff. International examples show it is possible to build faster and at lower cost. Singapore has the wealth and resources to match global peers in healthcare access. What remains is the political will to prioritize people over surpluses. As Liang Shihan argues, real security is when citizens know their country will care for them in sickness. The future of Singapore's healthcare depends on making that promise a reality.